Medicare for all. It's a big question for a lot of people as we head into the 2020 elections. Our next guest has some insight about the healthcare industry because he runs the largest private marketplace for health insurance. It recently beat on first quarter earnings and raised guidance for the year. And joining us to talk more about all of this and the company's earnings, eHealth CEO Scott Flanders. Good to have you here. Congratulations on the earnings report. Let me jump right there to that Medicare for all question. What kind of impact would you expect if the Democrats, because this is all politics right now, but if they were to get some kind of Medicare for all plan into place, what kind of impact would that have on the types of insurance that gets sold in a private marketplace as we're watching? Because it could conceivably be out the window.
Sure. I mean, the bill that's been promulgated by Bernie Sanders would actually outlaw all private insurance. So 180 million employer-insured individuals and families would lose the insurance they have now. So we think it's highly unlikely that that's in realistic prospect, but there will still always be a private insurance market for the treatments that aren't covered by a government plan.
And when you're looking at the platform as it exists right now, the eHealth platform that is, and people are shopping between different plans, have we seen that change since the ACA and as we've seen the political winds go back and forth over the past several years?
Yeah, so eHealth's a 22-year-old company, and we were healthcare.gov before that even existed. So that was really a redundant platform that was built to replace what was already available in the market. What we had to do, because our market shrank in the individual market, was pivot to healthcare for seniors. So this year we'll do 90% of our revenues in Medicare.
Well, I want to talk about seniors because a lot of us have elderly parents who are now in that covered by Medicare, but it doesn't cover all of the costs. As the population gets older, I think there was a report this morning that the baby boomers are going to be putting an even bigger strain on health insurance and the health sector in general. How do you, I hate to ask these kinds of questions as an investor, there's opportunity there, but it comes at the detriment perhaps of some of the people who aren't going to be able to get the care they need, or will they get the care they need?
Well, I think we should start off with saying that Medicare is the one aspect of the healthcare system that has high customer satisfaction. The hospitals, the doctors have all learned to live with Medicare. And so it's part of the system that works. That's why it's become a popular Democratic platform to say Medicare for all, because Medicare is an aspect of the system that's generally delivering on strong patient outcomes at a reasonable cost.
But they're talking about, because of the budget problems in the United States, the three largest expenses are Medicare, Medicaid, Social Security, and the defense. And they're talking about cutting Medicare.
Well, frankly, all the more reason why Medicare for all is nearly irrational to talk about. You're already saying, which I agree with Adam, that it's challenged to fund what we've already committed to our seniors. So to layer on another 180 million people outside of the employer market into Medicare would just collapse the system. But these are commitments that we've made to seniors. Seniors have paid into Medicare their entire lives. It is just not right to think about curtailing those benefits.
Scott, the pharmaceutical benefit managers have been under siege by Democrats and Republicans ahead of 2020. How do you see them? Are they friend or are they foe? Do they need to be regulated?
So you're talking about the PBMs. Yeah. It's a big political hot button. It's easy to attack the pharmaceutical industry, but it's important to remember they only represent 10% of the total cost of health care. And the medications that they create solve and cure a lot of diseases. And so I'm personally resistant, even though they're an attractive whipping boy, to go after them. They have to make a profit on the medications that work to pay for all of
Are they really lowering costs, though?
The PBMs are a different part of the system, and they have increased the cost savings by negotiating volume discounts, but they also bring an additional layer of expense into the system. I mean, that's the challenge with the ecosystem of healthcare today. It's just so Byzantine and complicated, it's hard to know where to go attack the costs.
Does your site help guide? When I signed up for healthcare here, my eyes bugged out. It's very hard to understand what's supposed to be simple forms. Is anybody working on clarifying and making it simpler to understand, whether it's at Congress or whether it's from the actual purveyors of insurance platforms?
Byzantine is a good word to describe it.
Yeah, and it's something you do once a year. It's not as much fun as planning a vacation.
Right.
You know, we say we want to make buying health insurance as easy as ordering an airline ticket on Expedia. Okay, that's a little bit ambitious on our part because it's hard. You do it only once. It's a highly consequential decision. That's not fun. And so people don't become expert in it because you only do it one time a year. But that is what we do. Okay, we're not perfect at it by any stretch, but we are the most comprehensive shopping comparison engine that exists on the web.
And very quickly, would it make it easier from your standpoint if Congress, because there's a push right now to require hospitals to have some kind of uniformity and stated price for procedures and the things that people go to for medical service, so that we all understand what we're paying for, but then we can go figure out what do we need to buy so that we can pay for it?
This is something we very much support. Increased transparency for the consumer is ultimately going to be the first step towards reining in the increasing costs of health care. So you're right on something. It needs to be talked about more. Consumers need to demand the transparency of pricing. You can't find out what the price of a procedure is until after you've already had it.
All right. Well, thank you for joining us, Scott Flanders, the CEO from eHealth.